recurrence, and it also showed that one of my lungs was also affected. So I was told I had stage 4.
And I squeezed the breast, and what came out was a reddish pus. Automatically that told me that things were not good.
I'm not my breasts. Just because I have one breast, it doesn't mean I'm less of a woman.
I preferred to die than being told that I have cancer.
So you check the whole breast, you go all the way around, and then you finish with the nipple. With the nipple, you can, you check if you're not feeling anything. You need also to squeeze your nipple a bit to check if there is any discharge.
Well, October is Breast Cancer Awareness Month, and this is a special episode of Health Nuggets as we create awareness and also share stories of breast cancer survivors just to give hope and save life, as this year's theme is giving hope to save a life. My name is Aida Muzati, and Health Nuggets starts now. Among non-communicable diseases, cancer has become one of the key public health challenges, causing undue suffering, emotional trauma, and financial burden to those affected. Statistics by the Ministry of Health shows that cancer is the third leading cause of death in Kenya after infectious and cardiovascular diseases. Over 40,000 cases are reported annually, with more than 32,000 deaths.
And with the various types of cancer, breast cancer, with some 5,900 new cases reported annually, is the leading cancer in the country. It accounts for 12.5% of all cancer cases and 20.9% of cancers among women.
Mwende is a 27-year-old breast cancer survivor. She was diagnosed with breast cancer stage 0 in the year 2015. However, in 2019, she was diagnosed again and now with stage 4 breast cancer. At such a young age, the news came with a fair share of fear, panic, and denial.
Late 2015, when I was doing the routine checkups on myself, I noticed there was a small lump in my breast. So I went to a nearby clinic to have it checked. Yeah, so the doctor dismissed the symptom I had and told me that because I'm young and there's no any type of cancer history in our family, that it'll just go away on its own. So after around 7 months, going to at least 4 hospitals, I was finally diagnosed with breast cancer stage 0, because at that time the tumor became a bit bigger than before. So when I was diagnosed, of course, the first reaction was I was so in denial, because I didn't check out in most of the risk factors which I had initially learned. I was young and we don't have any cancer, so basically I was a bit in denial. And then after getting the first results, I went for a second and third opinion, only for the results to come back the same. So I decided to start treatment. I had a surgery, the first surgery, which was just removing of the lump and the surrounding tissues, and I was told I was supposed to do radiotherapy. But now when I was due to start the radiotherapy, the oncologist, since I had done the surgery in a different hospital, so the current oncologist I had told me that I might still be having the tumor in my breast. So I had to start again from square 0 to do all the tests, which I did, and they came back and confirmed that I still had some tumors inside my breast. So at that time, I was given 2 options for treatment. One, to do another lumpectomy, which is now removing of the lumps, and then I redo the scans and what have you, or I do, and then after that, of course, I'll do radiotherapy. chemotherapy, or I do a mastectomy, which is the removal of the whole breast, and then I'll be on medication for 5 years. After the mastectomy, I was declared cancer-free. The cancer had not spread anywhere else, so I stayed for 3 years cancer-free until again last year when I noticed that I had a small lump underneath the mastectomy scar. I had it checked again with the doctor, and they informed me that it's just a cyst. It's just a cyst. After again a few months, I noticed on my neck, one of my lymph nodes was slightly swollen. So I went again to the hospital. We did more tests, and the results came back November last year and showed that I had stage 4 breast cancer, which meant that the cancer had also spread to one of my lungs. Again, of course, there's that, after the diagnosis, there's that feeling you have, you're scared. I was also feeling guilty. I was wondering, like, what did I do wrong?
For many women, breast cancer diagnosis is a life-defining moment. Salesa Atieno, a 45-year-old, is a stage 3B cancer survivor. For her, she contemplated death even before she got a clear cancer status results.
Immediately after my 4th form, I had a boil under my left breast. And I went to the doctor, and the doctor squeezed the boil out. And to me, I thought everything was okay. Until 20 years down the line is when the piece that was left there grew up into a lump. I never used to check myself. I thought that things were okay. And then by then, 2013, cancer was not that severe as it is in Kenya now. So one day, my husband, just like normal, he went through my breast and felt a lump. When he felt the lump, he was scared. He couldn't tell me. So he told me, like, after 3-4 days, and he asked me to go and check, to do a self-check on myself. So I didn't know what he meant. So he came back and asked me if I did the self-check, and I told him no. He told me, go to the bathroom, do a self-check on your breast. So immediately I went, did a self-check, and I felt a lump on my left breast, just under the breast. By the time when I realized I had a lump, but I didn't know whether it was cancerous or not. That was in February 2013. After that, I just guessed that that was cancerous, because it was measuring around 2.5 to 3 centimeters long. After that, I decided to run away from reality. I traveled up country. I decided to stay at home for like 2 more months. But one day I decided, now let me try and do a self-check again and squeeze. So I did a self-check and I squeezed the breast, and what came out was a reddish pus. Automatically that told me that things were not good. So I packed the following day. I traveled back to Nairobi. Decided that now I'm going to collect my results. That is more than a month after, So I had to come back. And when I come back, I still was not decided whether I'm going to collect my results or not. Stayed in Nairobi. We went for voting in the month of March. After that, I waited for the verdict. You know, Kenyan votes the way they go. I went for the verdict. I waited for the verdict. So it was on a Thursday that the verdict was supposed to be given. So I said, I'll not go for the results. I want to go where there is war, because I didn't want anything like cancer. So that I'm going to go where there is war. In case there is gunshots in the city, that's where I'm going to go. I preferred to die than being told that I have cancer. And that time I had a daughter who was around 3 years old. I decided to go with her, so that in case anything happens, let both of us go. Apparently things were peaceful in the city. There were no chaos. People were just busy with their usual businesses. So I just boarded a Nissan all the way to Machakos. I went for the results and I took my results to the doctor, who later disclosed for me that the test was, or the lump was cancerous, but he didn't tell me the staging. So I had to spend a night there so that I can at least come to my senses, because I was in a big shock.
In order to improve breast cancer outcome and survival, early detection remains the cornerstone of breast cancer control. A painless lump in your breast tissue could be a sign of breast cancer. Also, changes to the nipple such as redness, nipple reduction, discharge, and swollen glands. Though breast cancer is more common in women, men are also at risk. It knows no age, sex, race, religion, and socioeconomic status boundaries.
Wale wanasema kansa ni ya wamama, mugeuze, inaweza kamata hata wewe. Kwa hivyo mimi ni mmoja ya patients wa wale wanaendelea kutibiwa hapa, kama vile mmesikia, na sema siku ya leo ni siku muhimu sana kwangu.
We always hear breast cancer and we associate it with women. But also we need to remember men are at risk of breast cancer. And because we don't talk about it, our men don't know this. My message to the men, it is your job to also know yourself. And if you know your breast area, you will be better able to check what is normal, what is not normal for you. And also, men, you can be a tool to help our women discover breast cancer as well. So for your significant other, be aware of what the signs and symptoms are so that you can be able to help them.
Breast Cancer Awareness Month comes every October, and the display of the pink ribbon is hard to miss. The contemporary fight against breast cancer has succeeded in promoting visibility of the disease, in honoring those who have died from it, and in giving breast cancer survivors resources for navigating their diagnosis, as well as a sense of hope for the future.
So after I think it was maybe around 6 months after I did the mastectomy, that's when it hit me that, you know, actually my life has changed a bit. Because at the moment I can't wear some of the clothes I used to wear. I have to cover up. But I came to understand that, you know what, I'm not my breasts. Just because I have one breast, it doesn't mean I'm less of a woman. So I would tell anybody who has, you know, 2 breasts, 1 breast, no breast, that you are not your breast. So that should not define you. It's just something which happened to you, but that is not you. I would urge everybody, especially during like this month, to take advantage of all these medical clinics out there and the reduction of prices of the screenings. I would say that they should take advantage of this and go to be checked. And I would also add and say that, you know, it's not only women who get breast cancer, so men should also be checking and they should also go for screenings.
Don't listen to other doctors, those quack doctors, who will come and tell you your fingernails will peel off. They'll tell you a lot of funny things. Like there's a person who told me that my nails are going to come out and I'll never have fingernails. So it made me cry a lot. So I was wondering, how am I going to walk without fingernails? Though they were blackish, but at the end of it, they didn't come out. So if you pay attention to those quack doctors, they'll just discourage you. They'll not encourage you at all. Secondly, do what your doctor tells you to do. Wake up, give yourself strength, don't think negatively. Always be positive about yourself.
Kwa hivyo hata mimi niko na tumaini ati nitaondoka Kenyatta nikiwa afita. Kwa hivyo ndugu wangu, usikae chini huko au uone aibu, useme mimi ni aibu sana kusema matiti imegojeka. Hata wewe ni binadamu kama bibi yako, dada yako au shosho. Kwa hivyo tafadhali naomba wase, hata nyinyi vijana jitokezeni. Ukikusikia uko na hiyo kakitu, kuja ona daktari, alafu atakwambia the next step ile mtachukua mkiwa pamoja.
Of greater concern is the fact that awareness on early detection of breast cancer and uptake of screening services remain low. Only 25% of women aged 15 to 49 years have performed a self-breast examination, while 14% have had a clinical breast examination.
So as you've heard, breast lumps are one of the signs of breast cancer. And on set, I'm being joined by the amazing Mwende Motiso, and through her, we're going to learn how to do a self-breast examination. Mwende, first of all, thank you very much for joining us on Health Nuggets.
Welcome, and thank you as well for inviting me.
Thank you. So how did you learn to do this?
Okay, as I had mentioned before, I had joined this organization called Resource Center for Women and Girls, and through the program we had different medical camps, and in one of the medical camps I went to, we were joined by nurses, doctors, and some breast cancer survivors, and they showed us how to do the self-examination.
So you say that you felt a lump. Yes. So how does it feel like, even before we go to the practical part of it?
Okay, so I think you wouldn't miss it. It's something really hard. The size varies from one person to the next, but usually it's really small and it feels like maybe a bean which is inside your breast. So once you're doing the checks, you'll feel like something, you might feel the lump. And at the same time, there are some breast cancers which do not have lumps. So, but basically the lumps are one of the red flags which need to be checked if you have.
Mm-hmm. Yeah. Okay, so we can just go straight to it.
Okay, so I'll use one of my prostheses to first show you before I examine myself. So basically, what you need to do is take 3 of your fingers, and then you press gently and a bit firmly, but don't poke your breast, so that it's not supposed to be painful at all, but it needs to be gentle but firm at the same time, since you need to check. And what you normally do is you just go around, you just feel if there's anything you feel which might be inside your breast. So you check the whole breast, you go all the way around, and then you finish with the nipple. With the nipple, you can, you check. If you're not feeling anything, you need also to squeeze your nipple a bit to check if there is any discharge. Because sometimes you might find that in your nipple, when you squeeze it, maybe blood can come out or some discharge which you don't know about. So yeah, you just basically need to do that. And you also need to check not only your breast, but you also need to check like the collarbone, and also on your neck, to check if there are any lymph nodes which are swollen, and underneath your arm and armpit, in the armpit. So you need to check if there's any swelling at all. So do you want to try?
Okay.
Yeah. So just take 3 of your fingers, and this other hand. So if you're checking your left breast, you need to put your left hand behind your head, and then you just start checking. You start checking from your breast. You just go all the way around slowly. I actually found that lump while I was watching a movie. I was seated on the sofa. And I was just checking. So that's how I check. So you just check all the way around, and then you squeeze the nipple a bit. You press to feel if there's anything. The lump most times move a bit. So yeah, you do that, and then you check on the collarbone. Yeah. So yeah, you check on the collarbone, underneath your armpit. You just check if there's anything. So basically, you just need to check all the, because we have so many lymph nodes here. And sometimes when you have breast cancer, the affected lymph nodes most of the times are the ones in your underneath your arm, in your armpit. So you just need to check if there's anything which is swollen, which it might be painful or not. For me, there was no pain at all.
Okay, so from experience, what are some of the myths that come with self-breast examination? Because I hear that at times you can maybe stand in front of a mirror, then do this.
Yes.
When one of your breasts is, the other one is up, the other one is down, maybe that's a sign, or is it just a myth?
It's actually a sign. So you need to do, okay, so this self-examination you can do when you're sitting up, and you can also repeat the same process when you're lying down, so that, it will be easier actually when you're lying down. And the one you've just mentioned, it's actually not a myth, it's also a fact, because the tumor, if you have a lump, most of the time it's heavy. So when you put your hands up and you're looking at your reflection, sometimes the affected breast won't go up. You'll notice that only one breast is going up and the other one is not moving as the other breast. So you need to check that out. If your breast is too big, one of your breasts or both of your breasts, if they're becoming big without any reason, that is also one of the red flags. So you need to check for that. I said the discharge again in your nipple. If your nipples are going in, I cannot remember the word, but if your nipples are going in, you also need to have it checked. It might be a sign. If you're experiencing any pain, any swollenness which is not being explained, you don't have an explanation for. If your skin is also different, it can be a rash or something. If there's anything which looks a bit of a miss, then you need to have it checked. And it doesn't necessarily mean that it's cancerous. You might get a lump, and when you get it checked, it might be a benign, which are not cancerous. Yeah.
Okay, and what's the right time for a woman to do this? Is it any time of the month, and how many times should you do this?
Okay, so I usually do before I was doing like once a month. Right now I think it's a bit of a habit, so I do quite frequently, but I think once a month is okay. And I would advise people not to do before their periods, because sometimes you might feel maybe your breast tissues might harden.
They're usually different at that time.
Yes, and you might mistake that as for a lump. So when you're not nearing your periods, that is the best time to check. And you don't need to wait till you're 40 to start doing the screenings, because I remember even before I thought you have to be, actually you have to be over 40 years for you to start going for mammograms, or that is what we were told. So I would suggest that, as long as you have breast, you need to start checking. It doesn't harm to just go for screenings. Yeah.
Okay, you brought out a very important part, as long as you have breast.
Yes.
For the self-examination, does the same apply for men?
Yes,
when they are checking?
Yes, it does, because they also have breast tissues, and it's the breast tissues which get affected. So not many men get breast cancer, but there's a chance that they also might get. So they should also be checking. And the self-examination is still the same. You just check if there's anything which is amiss. Yeah.
All right. So we have the prosthesis here.
Yes.
Let's just take our audience through all that. Maybe how you use them.
Okay. Yeah. Okay, so as I had mentioned before, I did a mastectomy, which is removal of the whole breast, so I don't have my right breast. So what I do is we have special bras, and these are called prosthesis bras. They have a pocket they have this pocket where you now put the prosthesis. The prosthesis is basically just the fake boob. So you need to put it in. The reason we use these prosthesis bras is so that they can hold the breast. If you don't use it, you know, your breast might fall down. And I remember even before I got mine, since they are quite expensive, I used to just wear the normal bras and I would put this prosthesis there. But another problem was, like, when I forget and you know, maybe pick something down and my boob will fall down and I will start looking for it. So it's, yeah, the prosthesis bra is really important. So that is how you use them. There are different ones. These ones, these are I think made of gel, but they are a bit pricier. At the moment in Kenya, I'm not sure which woman, most probably it's a woman, who came up with this idea, this brilliant idea. So they are made, they are knitted and they are filled with fiber. They are cheap to get and they are quite comfortable. They are not hard, you know, since sometimes if you have like a hard prosthesis, it might hurt your chest wall. So you need something really soft, and the soft ones are really expensive and they're not as available as, you know, they're not readily available. So this is a perfect economic way to deal with this situation.
Talking over perfect and economic, yes. How much does the bra cost and the prosthesis cost?
Okay, so I'll start with this. So this one costs approximately 300, depends with the person who's making them. This was actually made by one of the breast cancer survivors because she could not afford this. So I got this in town. I can't remember the shop, but I think I got them for this was almost 4,000. But again, the quality is not good. And this one, this I got from my mentor, who's also a breast cancer survivor, but she didn't buy it in Kenya, and this was 40,000. So I'm not sure how much this is here in Kenya, but they are pricey. Yes.
Okay, so Mwende, once you felt that lump, what should someone do from there?
You should go to a hospital. It will be better if you go to a hospital where they also deal with cancer treatment to get better assistance. You know, if you're able to see maybe a breast surgeon, or just go to a breast clinic, actually, that will be the best place to start. And yeah, once you're there, you'll be guided on the way forward.
Well, that is all we had for you from Health Nuggets, and remember that October is Breast Cancer Awareness Month. So before October ends, kindly go for a breast cancer screening, or as we've been shown by Mwende, do the self-breast examination for you to detect those lumps early, for early detection saves life. Thank you for everyone who made this episode a success. Thank you to the warriors and thank you to the breast cancer survivors. My name is Aida Munzati, and as always, your health matters.